The CoPilot VL system was designed with an acutely angled blade. Research shows that the acutely angled blade provides the best laryngeal view on the largest variety of patients. Improved laryngeal views don't always mean a higher intubation success rate, so there are some techniques that can help improve intubation success. Begin with the patient's head in a neutral position. If possible, position the patient so that the ear and sternum line up. Have your endotracheal tube with a stylet or bougie ready. Using the CoPilot VL proprietary rigid stylet is ideal, but a malleable stylet with an approximate bend will work. A little bit of water-soluble lubricant on the stylet or bougie, as well as on the tip of the endotracheal tube, helps everything to slide more easily. Keep your eyes on the patient while introducing the sheath midline in the mouth until it reaches the oropharynx. There have been documented injuries with other VL devices, presumably from operators watching the monitor instead of the patient. This is more of a scooping technique than the traditional forceful lift. Think finesse, not force. Take your time and make sure you don't insert the sheath too far. You're looking for the epiglottis. Stop once the tip of the sheath enters the vallecula. A grade 2A or 2B view can be easier to intubate than a grade 1. Be sure to watch the endotracheal tube as it enters the mouth and the tip disappears from view behind the tongue, then look up at the monitor. Using the fishhook technique helps the tube into the mouth and medial to the back molar. You want to see the tip of the endotracheal tube come into view on the display in the lower right-hand corner. If it's not there, you need to back the tube out and try again. Once you see the endotracheal tube, then it's time to use the stylet to steer the tube to the glottic opening. Stop at the vocal cords and back the stylet out a little before advancing the tube into the trachea. You don't want the stylet entering the glottis. Again, make sure you see the endotracheal tube enter the display on the lower right-hand side. Then use the stylet to steer the tube towards the glottis. See the endotracheal tube enter the right lower corner? And then use your stylet to advance it and steer it up towards the glottis. Stop as you reach the opening, remove the stylet, and finish your intubation. Okay, so today we're doing an intubation with the rigid stylet. I've already got my CoPilot turned on so that the sheath is nice and warm, which will prevent fog. We're going to open up her mouth, place the sheath midline, watch as it disappears behind the tongue, and then we'll take a look up at the monitor, looking for the epiglottis. There it is. Advance slowly into the vallecula. There we go, we got a good view of the glottis and the vocal cords. I'm going to take my endotracheal tube, watch as I place it behind, medial to her back molar, and it's going to disappear behind the tongue. And then I'm going to look up on the screen and watch it as it enters the lower right hand side. You see the tip of the tube there? And then that's how you know which direction to guide the tube. And if you need it to go more anteriorly, you can use the slot machine technique to lift the end of the tube, advance it till it reaches the glottis, stop there, bring your stylet back, and then you can finish your intubation. And that's it. We created the CoPilot VL Bougie port for one reason: to simplify intubation. The CoPilot is the only VL on the market with the Bougie port feature. First, choose the correct size sheath. Size 3 should be for patients 5'6" and under, size 4 for taller patients. Obtain a view of the glottis, then slide the bougie through the C-shaped bougie port channel unless you've preloaded it first. On the monitor, watch the bougie exit the distal portion of the disposable sheath and enter the glottis. Slide the endotracheal tube over the bougie, dislodge it from the C-shaped channel, and watch it on the monitor as it enters the trachea. As with the endotracheal tube, watch for the bougie coming into view on the lower right-hand side of the screen. If you don't see the bougie, it is either dislodged or heading at the wrong angle. When you're using the bougie to intubate, watch as the bougie enters the display on the right-hand side. You just need to advance it far enough through the vocal cords so that it will stay. It doesn't have to go all the way down to the carina. And then slide your endotracheal tube over the top of the bougie and finish the intubation. Occasionally, the tube will hang up on the arytenoid and stop. If this happens, turn the tube 90 degrees to the left and continue to advance. Never advance if resistance is met. Sometimes when you're using a bougie to intubate, you may find that the endotracheal tube wants to hang up over here on this left-sided arytenoid. If that happens, all you need to do is turn the endotracheal tube 90 degrees counterclockwise, and that flattens the bevel out and will be easier for the tube to pass through the vocal cords. So today we're going to do a bougie port intubation. I already have my CoPilot turned on so that it heats up the sheath and we won't have any issues with fog. Next thing I'm going to do is take my bougie and preload it into the side of the sheath so that the coude tip is extended just a tiny bit past the tip of the sheath. I'm going to open my patient's mouth, go down midline, watching into the mouth until the sheath goes behind the tongue, and then I'll take a look at my screen and get a good view of her vocal cords and epiglottis, and then gently slide the bougie off. So it just goes through her vocal cords. Then grab your tube, slide it over the top, make sure it comes out the side of the channel. I've got a tiny bit of water-soluble lubricant so it goes behind her teeth nicely. Again, watching. If it hangs up on the arytenoids, all you have to do is turn the tube gently 90 degrees and it will pass right through the vocal cords. Remove your sheath and you're done. Across the board, the most common error when learning VL is moving too fast and getting too close to the glottis. Backing away from the glottis a little will almost always facilitate intubation. Make sure to look for the endotracheal tube or bougie to come into view on the monitor on the lower right-hand side. Often, users have advanced the tube or bougie too far already posterior into the left-hand side, which makes it harder to advance. Simply withdraw the tube and advance again around the corner of the tongue until the tip comes into view. If the endotracheal tube appears to hold up on the anterior portion of the tracheal wall, try retracting the stylet by about 4 centimeters. This can straighten the end of the endotracheal tube and help it align better with the axis of the trachea. If you find you're having difficulty advancing the bougie through the bougie port, make sure you're not pushing the bougie straight down. The bougie should be inserted at about a 45-degree angle. Just relax your angle and it should slide smoothly. Also, use the CoPilot VL proprietary bougies. Other bougies can be less flexible and may not slide as easily.